Hi there, I'm Dr. Emily Porter in Austin, Texas, and I'm here today to talk about erectile dysfunction and the way that we use GAINSwave treatment to treat it. So GAINSwave is low-intensity shockwave therapy. It's been used in Europe for over 40 years on sexual dysfunction. We use the machines for creation of blood flow in other parts of the body. We can use it on legs to help regrow blood vessels. And the problem with erectile dysfunction, a lot of times it's because you have clogs in arteries. So just like men have heart attacks or strokes or things, because those are bigger arteries, but the arteries in the penis are much smaller. So sometimes men will suffer from erectile dysfunction before they know that they have other clogged arteries. So what GAINSwave is it's low-intensity shockwave therapy. We use high-intensity shockwave therapy to treat kidney stones. So this is low intensity. It's just a different level of energy. And we treat the penis. We treat all the erectile tissue that's around the penis. And what we're doing is we're using those shock waves to break apart plaques that are there. So we can immediately expect that any soft plaques can be cleared away from the arteries. And then over time, we're creating new blood vessel growth. The micro trauma that happens from the shock waves in the tissue, it stimulates new blood vessel growth. I like to use analogies, and we've all driven on Mopac, and we know how miserable Mopac can be. So Mopac during rush hour is even worse. And then when you have a wreck on Mopac during rush hour, things can really come to a standstill, and that's frustrating. So what GAINSwave would do is the treatments would be like bringing a wrecker in and clearing the wreck so that now you have your regular flow back. And then over time, it would be like adding a couple lanes in construction. So immediately you're going to have increase in sensitivity and blood flow, and then over the course of about 2 to 3 months you're going to have new blood vessel growth. So it's kind of the equivalent of adding a couple lanes. So you clear the wreck and now you have a couple new lanes, so now things can flow better. So what's not possible is if somebody has not had an erection in 20 years, they've got lots of stents in their heart, or they have diabetes, or they're on that's been untreated and they haven't seen an erection in a long time. I mean, I can't raise the dead. So I can't necessarily help that with GAINSwave, or somebody who maybe is on dialysis. But for the average man whose performance has dwindled, who can get hard but isn't as hard as what they were, or maybe they are relying on Viagra or Cialis, or they're having to use medications, the goal is to be able to decrease those doses or eliminate those. So what is possible is I can help somebody who's on low-dose Viagra or Cialis, or is performing but just not as well as they were before. I can help them with GAINSwave shockwave therapy. So I hate to see marriages suffer. I hate to see self-confidence suffer. I hate to see men's work performance suffer as a result of them not feeling confident and them having difficulty performing. I see it in my office all the time, but I love to give men confidence. I love to be able to bring couples together. Most of my men are married or have partners, and they love their wives or their partners. And I love to be able to help them and make relationships stronger. So if you're suffering and you think that GAINSwave might help you, I would love to see if you're a good candidate. Please reach out via our website or give us a call.